I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors, and with me I have Dr. Jonathan Sherin, our Director of Mental Health, who's going to talk to us about really what is going on as it relates to the coronavirus and the fact that we've got a lot of people who are facing anxiety and uncertainty, having the safer at home order in place. And so, Dr. Sherin, you know, a lot of people are facing this anxiety. Is that natural? And what do you suggest they do as it relates to dealing with all the uncertainties that are going on right now?
Anxiety is provoked by unsure situations, the unknown, the need to change routines. And what we really have to recognize is that as there's a new order, we have to adjust. And that the adjustment, while it can be disruptive, doesn't have to be something that is bad. So staying at home actually offers people the chance to do things that they have not been able to get to for a long period of time, to relax, to maintain good routines. So sleeping well, eating well, exercising when possible. It's important that new routines be developed as well to fill in time. So hobbies that have been left unattended for a long period of time are opportunities for people. What's really critical at the individual level is that we don't engage in unhealthy type routines. So drugs and alcohol, really, really bad. A bad way to deal with anxiety and something that frankly provokes more and more anxiety over time.
So, Dr. Sherin, what you're saying is, I mean, we're out here at Grand Park today and we're practicing the social distancing, but we're also looking around and kind of getting exercise, but also taking everything in and just kind of relaxing. So this is the kind of thing people should do at least daily while they're staying home.
Yes, I would say so. It is important to kind of reset and reflect upon opportunities for us to engage in new routines, and that doesn't have to be threatening. And the other thing that's really important is change is difficult. So people would normally feel anxiety in the context of this kind of a situation. Some people are able to kind of get through it. They can reach out to their family, to their friends. Others who are having more difficulty, and particularly people who have struggled with mental health issues over time, may need more assistance. And we would encourage individuals to reach out to the Department of Mental Health. I have the helpline number right here with me. It's 800-854-7771. And we encourage individuals, families that are struggling, to reach out to us. And whether we deliver services ourselves, through our therapists, through our doctors, or we make referrals to other resources, we're here for the people of Los Angeles County.
So for those people that, you know, always feel like they can handle it and all, this is not an unusual feeling to have this anxiety. I mean, it's a natural feeling given what we're going through.
I would say absolutely it's normal. You know, again, unknown issues, fears that are provoked by different environments and the need for change, very common. In fact, we would expect that people have challenges with anxiety adjusting to new way of life for a period of time. So individuals that are kind of feeling that anxiety ought to figure out ways themselves to manage their care, and always reach out. Reach out, whether it's just to someone that you trust and love, or to get help if that's indicated. And the Department of Mental Health is here to provide those services or to connect people with resources that may be provided otherwise.
So really what you're saying too is that just because we're asking you to stay at home doesn't mean you're going to have to isolate yourself. In fact, it's just the opposite. You have opportunities to really get out there and connect, but just social distancing, keeping that in mind, you can still be very much vibrant and live life as we know it.
I would completely agree. The importance of a healthy physical space is critical as a public health approach. The importance of maintaining a connected community is critical. And we're learning new ways in real time to do those things. And my sense is that when we get through this together, we're going to be a more cohesive community. We're going to be a stronger county, and we're probably going to figure out ways to do our work and our play more effectively.
Well, you know, I mean, I guess my takeaway too is I tell people to be kind. We're all going through this together, and it doesn't matter what your profession is or where you land as it relates to age. We all have different ways of dealing with stress and anxiety, but at the end of the day, I think it's important for people to be kind and also recognize that asking for help is okay.
Kindness is the order of the day. And we see kindness. We see people volunteering to bring food and meals to elderly who really need to be careful about being in the public space. We see kindness every time we wash our hands, every time we keep a distance between ourselves but smile at each other and acknowledge each other. It's also critical, as you state, to realize that it's normal to feel anxiety. It's normal to feel unsettled and to feel like your life is has been disrupted, but we're here to help you. The County of Los Angeles is here to help you across our departments and in the Department of Mental Health 24/7.